Hi, today I'm going to talk about diabetes and what it means. This is a topic that's near and dear to my heart because I've spent the last 20 years managing diabetes, type 1 and type 2, as well as many other types of diabetes. And I've been working on trying to prevent type 2 diabetes in children. This is the main reason that I started this course as well as my practice. So today we're going to talk about diabetes and what it means. Diabetes is a medical condition that's characterized by high blood sugar levels. It happens when the body either doesn't produce enough insulin, such as in type 1 diabetes, or it cannot effectively use the insulin it produces. Here's what diabetes means. Insulin is a hormone that's produced by the pancreas. The pancreas makes this hormone in response to eating sugar or food in general, which gets converted to glucose. Insulin plays a critical role in regulating blood sugar and glucose levels in the body. Insulin helps glucose enter the cells where it is used as a source of energy. In diabetes, there is an abnormality in insulin production or insulin use, leading to elevated blood sugars. So either insulin is not made, such as in type 1 diabetes, or insulin is not being produced to the level it needs to be produced, leading to elevated blood sugar levels overall. Type 1 diabetes is also known as insulin-dependent diabetes, or in the past, it used to be called juvenile onset diabetes, and it occurs when the pancreas fails to produce insulin. This type is typically diagnosed in childhood or early adulthood and requires lifelong insulin therapy. Type 1 diabetes is an autoimmune disease where the body's immune system mistakenly attacks and destroys the insulin-producing cells in the pancreas. Type 2 diabetes develops when the body becomes resistant to insulin, or when the pancreas doesn't produce enough insulin to meet the body's needs. Risk factors for type 2 diabetes include abnormal weight gain, not getting enough exercise, also genetics, and a diet that is high in processed foods or high in sugar overall can sometimes lead to abnormal glucose control. Symptoms of diabetes include increased thirst, increased urination, unexplained weight loss, especially in type 1 diabetes, fatigue, and blurry vision. People with type 1 diabetes may also experience increased hunger and irritability. However, some individuals with type 2 diabetes may not experience any symptoms at all. The definition of diabetes is a fasting blood sugar over 126 or a random blood sugar over 200. Doctors also use a test called a hemoglobin A1C that helps to tell us whether or not you have diabetes. Poorly managed diabetes can lead to many long-term complications affecting multiple organs. These complications include heart disease, kidney damage, nerve damage, eye problems, and foot ulcers. You can also see yeast infections or other infections that don't heal well. Regular monitoring, proper treatment, and lifestyle modifications can help reduce the risk of complications in diabetes. People with diabetes often need to monitor their blood sugar levels regularly. This is typically done through a fingerstick blood glucose test using a glucometer or a continuous glucose monitor that can provide real-time blood sugar readings such as the Dexcom or Freestyle Libre. Treatment for diabetes depends on the type and severity of the condition. Type 1 diabetes is managed with insulin therapy, usually through multiple daily injections or an insulin pump. Type 2 diabetes can be managed with lifestyle modifications like healthy eating, regular physical activity, and weight management. In some medications, oral medications, insulin injections, or other types of medications can also be prescribed. Effective diabetes management involves maintaining healthy blood sugar levels, blood pressure, and cholesterol. It also includes regular physical activity, a balanced diet, control of weight, and monitoring of other risk factors and stress as well. Diabetes management often requires a multidisciplinary approach involving healthcare professionals like doctors, nurses, dietitians, and diabetes educators. It's important to note that diabetes is a manageable condition, and with proper self-care, individuals with diabetes can lead healthy, fulfilling lives. Children with diabetes, including type 1 diabetes, can do anything that their peers can do. Early diagnosis, regular medical checkups, and adherence to treatment plans are really essential for effectively managing diabetes and minimizing the risk of complications. If you have further questions about diabetes or your child specifically, please contact me for an appointment or an evaluation.